Today, we are going to study about joint mobilization. Joint mobilization. It is a type of passive movement applied to joint and related soft tissue at varying speed and amplitude. It is usually targets synovial joint. It refers to manual therapy technique that are used to modulate pain and treat joint dysfunction that limit range of motion by altered mechanics of joint. The altered joint mechanics may be due to pain and muscle guarding, joint effusion, contracture or adhesions in the joint capsule or supporting ligaments or subluxation of bony surfaces. Now, we discuss about joint shapes in our human body. The type of motion occurring between bony partners in a joint is influenced by the shape of the joint surfaces. The shape may be described as ovoid or cellar. In ovoid joints, one surface is convex, the other is concave. In cellar joints, one surface is concave in one direction and convex in the other direction. Now we talk about types of motion in brief. Roll. A series of points on one articulating surface comes into contact with a series of points on another surface. Roll occurs on incongruent surfaces. For example, ball rolling on ground. Femoral condyles rolling on tibial plateau. Slide. When specific point on one surface comes into contact with a series of points on another surface. In slide surface are congruent. When a passive mobilization technique is applied to produce a slide in the joint, it is referred as a glide. Spin. This motion occurs when one bone rotates around a stationary longitudinal axis of another bone. Shoulder with flexion or extension, the hip with flexion or extension, and radial head at the humeroradial joint during pronation or supination are the examples of spin. Compression. It is decrease in space between two joint surfaces. It adds stability to a joints. It is a normal reaction of a joint to muscle contraction. Distraction. When two surfaces are pulled apart, it is known as distraction. It is often used in combination with joint mobilization to increase stretch of capsule. Traction. It is a longitudinal pull at the long axis of bone. Now it's time to discuss about convex-concave rule. Concave-convex rule. In concave-convex rule, concave joint surfaces slide in the same direction as the bone movement. In this, convex surface is stable. If concave joint is moving on stationary convex surface, glide occurs in same direction as roll. Convex-concave rule. In convex-concave rule, convex joint surface slide in the opposite direction of the bone movement. In this rule, concave surface is stable. If convex surface is moving on stationary concave surface, gliding occurs in opposite direction to roll. Now it's time to discuss about the grades of mobilization. Basically, two systems of grading for mobilization are used, which are as follows: graded oscillation technique, and sustained translatory joint play techniques. Graded oscillation technique. It is also known as Maitland grading. It is divided into 5 grades, whose are pronounced in Roman numbers. These grades are as follows. In grade 1, small amplitude rhythmic oscillations are performed at the beginning of the range. In grade 2, large amplitude rhythmic oscillations are performed within the range, not reaching the limit. In grade 3, large amplitude rhythmic oscillations are performed up to the limit of the available motion and are stressed into the tissue resistance. In grade 4, small amplitude rhythmic oscillations are performed at the limit of the available motion and are stressed into the tissue resistance. In grade 5, a small amplitude, high-velocity thrust technique is performed to snap adhesions at the limit of the available motion. Uses of oscillatory grading are: grades 1 and grade 2 are primarily used for treating joints limited by pain. Grades 3 and grade 4 are primarily used to increase range of motion. Sustained translatory joint play techniques, also known as Kaltenborn grading. Basically, there are 3 grades. Grade 1, also known as Lucen, In this grade, small amplitude distraction is applied where no stress is placed on the capsule. Grade 2, also known as tighten. In this grade, enough distraction or glide is applied to tighten the tissue around the joint. Grade 3, also known as stretch. In this grade, large enough distraction is applied to place stretch on the joint capsule and periarticular structures. Uses of Kaltenborn grading are as follows. Grade 1 is used for relief of pain. Grade 2 is used to inhibit pain and maintain joint play when range of motion is not allowed. Grade 3 is used to stretch the joint structures and thus increase joint play. Now we discuss about the effects of joint mobilization. First is neurophysiological effect. Joint mobilization increase in awareness of position and motion because of afferent nerve impulses, also stimulates mechanoreceptors to decrease pain. Second is nutritional effect. In this effect, by movement of synovial fluid nutrient exchange improves. Third is mechanical effect. In this effect, there is improved mobility of hypomobile joints and also maintain extensibility and tensile strength of articular tissues. Now we talk about the indication, where we know about in what conditions we give joint mobilization. These indications are painful joints, muscle guarding, decrease range of motion, spasm, progressive limitation, functional immobility, and positional fault. Apart from indication, we also know about the contraindication of joint mobilization, where there is no use of or there will be adverse effect of mobilization. These contraindications are hypermobility, inflammation, joint effusion, malignancy, unhealed fracture, total joint replacement, osteoporosis, injury, immediate after surgery, and elderly individual with weakened tissue. As indication or contraindication, there is some precautions where if we took some preventive measures, joint mobilization is very effective in following diseases, like osteoarthritis, pregnancy, severe scoliosis, poor general health, patient's inability to relax. Now it's time to discuss about the limitation, as you all know that mobilization technique cannot change the disease process of disorders such as rheumatoid arthritis or the inflammatory process of injury. In these cases, treatment is directed towards minimizing pain, maintaining available joint play, and reducing effects of any mechanical limitations. The techniques are relatively safe if directions are followed and precautions are taken properly. If precautions are not taken or applied too vigorously, joint trauma or hypermobility may result. After discussing limitations, we also keep things in our mind, like all joint mobilizations follow the convex-concave rule. Patient should be relaxed. Explain purpose of treatment and sensations to expect to patient. Evaluate before and after treatment by goniometry. Stop the treatment if it is too painful for the patient. Use gravity to assist the mobilization technique if possible. Begin and end treatment with grade I or grade 2 oscillations. Patient and extremity should be positioned so that the patients can relax. Initial mobilization is performed in a loose packed position. Firmly and comfortably stabilize one joint segment, usually the proximal bone, by help of hand, belt, or assistant. Appropriate stabilization prevents unwanted stress and makes the stretch force more specific and effective. Thank you for watching this educational Notes video series. Comments and suggestions are welcomed for improvement of this and future upcoming videos. And please do subscribe, like, and click on bell icon.